Well, this week marks World Breastfeeding Awareness Week. We are looking at the benefits of breastfeeding this morning with Jaime Burelson, a lactation consultant at Rochester Regional Health. Good morning.
Good morning.
Thanks so much for joining us. And I have to say that I love you guys. You guys are angels. I had you on speed dial with all three of my children.
That's amazing.
As we recognize this week, what do you want people to consider or take away? Because sometimes there is a bit of a debate over, whether to breastfeed or not breastfeed. And certainly we are not here to shame people for the choices they make. I just want to put that out there up front. But for people who are considering this or have so many questions, what do you want them to take away from in this week in particular?
I love that you said that because I'm not into shaming. I want people to make an educated choice, right? And as long as everybody has the education, they get that prenatally. They can take classes, breastfeeding classes in pregnancy. That's the biggest thing, is just making sure that the families have the education. So the recommendation by the American Academy of Pediatrics is that every baby should be exclusively breastfed for the first 6 months of life. Starting at 6 months, the pediatrician will recommend what solids to start, and then babies should continue to be breastfed for a year or longer, however long mom and baby wish to continue for.
Yeah. So let's say we've got an expectant mom out there who's watching, and expectant father as well, or a couple. It's their first time, maybe it's their third time, and they're a little anxious about this whole endeavor. What do you say to them?
So, just explaining to them that it's a process, right? Just like pregnancy. In the beginning, it's a lot of nerves and uncertainty. Towards the end of pregnancy, they get really good at it. And that's how it's going to be with breastfeeding. The first couple days are going to be a lot of learning, a lot of questions. That's where in the hospital setting, having the trained staff to help you is huge. Going home, there's lots of support as well. So, having all of their needs met in the hospital, and then discharge teaching and discharge follow-up is huge as well, because there are a lot of questions.
Yeah. How important is it to have support, not only from a lactation consultant, but from employers, the community, family? How important is that?
It's not really any different than the importance of that support during the pregnancy and being a parent too, right? The more support you get, the better. Breastfeeding seems to have a lot of nervousness about it, right? So to have supportive family members and employers that really understand what the family's desires are as far as feeding their baby can only help these patients. And moms really need that support, not just being a first-time parent or a breastfeeder, just the overall support is huge for them.
Yeah. So let's talk about the benefits of breastfeeding. What are they?
Yeah. So there's benefits for baby and there's benefits for mama. So babies that breastfeed are just healthier. They have less illnesses, so less respiratory tract infections, less ear infections, less vomiting and diarrhea. They have lower risk of asthma, obesity, diabetes, different types of allergies, skin conditions like eczema, bowel disease, SIDS. There's lots of other things that they're currently researching that they believe babies have a lower risk of that are breastfeeding as well. And then for mama, I always try to speak about the benefits to mom, because no mom wants to breastfeed simply for her benefit, but it's nice to know that there are times where she can realize that the benefits are also for her as well. So moms that breastfeed have a lower risk of postpartum depression. They have a lower risk of type 2 diabetes, of heart disease, of GYN cancers, so breast cancer and ovarian cancer, lower risks of hypertension as well. And the longer she breastfeeds, or the more children she breastfeeds, the better risk reduction. Then there's the whole no mixing, no measuring, no warming, no dishes, which is certainly nice and convenient as well.
Yeah, well, until you have to go back to work, and then you've got to have all those bottles prepped.
Yep. But that's also something that lactation can help you with in the hospital, because a lot of moms do have to go back to work.
Yeah.
So they can certainly talk to you about the prep for going back to work and how all of that works.
It can be so overwhelming, but good to know that there is help in our community. Where can families go for support and just knowing their options?
Perfect. So at discharge, whatever hospital you deliver at will give you their lactation office phone number. You can call whichever lactation office you want. You don't just have to call the office that you delivered at that hospital. Your pediatricians are a wealth of information. There are baby cafes that are free places with, it's all virtual right now, but free places with live support staffed by lactation consultants to help with any sort of breastfeeding questions, concerns. There's live meetings every week. You can go to babycafeusa.org to get a listing of those. So those are great for pregnant people, for anybody in any stage of lactation. And then you can also go to La Leche League, which does free meetings as well for breastfeeding support.
All right, a lot out there. Jamie, thank you so much for your time.
Thank you, Alexis. Take care.